Good afternoon. It's been a rough couple months, not only for the state but for the country. It's never easy when you see people getting sick. Obviously, people have ended up in the hospital, and unfortunately, people have died. People have sacrificed a lot to be able to fight the spread of this virus. We've seen people out of work in numbers that we're not used to, and I just want to tell people, I appreciate all the efforts throughout the state of Florida. I appreciate folks who have, done the right thing, and for those who have been negatively affected, we are definitely thinking about you too, and we're gonna figure out a way to get back. And I think that there are some hopeful signs in terms of what the next steps would look like. We have this week a number of great people throughout the state of Florida who have been working on these groups for the task force for the next step for the state of Florida. They've done over 20 hours of meetings, a lot of great ideas. That's going to be called, presented. We're going to be going through that and working on different ideas for how we go forward in a safe and methodical way in the state of Florida. I appreciate all their involvement, and I think that will be a bright spot, the fact that we were very thorough and methodical about this. I also have some other good news. We have to look forward and continue to do some of the things we were doing, helping Florida's economy, creating really good high-paying jobs. That's something that we've been focused on like a laser from the beginning. And today we have an exciting announcement along those ends, towards that end. And I'm very excited to be able to announce that Ariane Supersonic, an aerospace company focused on high-speed flight, has selected Melbourne, Florida as the location for their new global headquarters. Ariane will invest over $300 million in a new campus at the Melbourne airport, where the company will design and build the new AS-2 supersonic business jet, the world's first practical, efficient, and environmentally responsible supersonic business jet that can fly at speeds of up to 1,000 miles per hour. Importantly, the new headquarters will also be home to over 650 new high-paying jobs with an average salary of $105,000. And if you recall, last November, I announced that we awarded nearly $4 million to the Melbourne Airport Authority for infrastructure improvements at the Orlando-Melbourne International Airport through the Florida Job Growth Grant Fund. We made that decision so that the airport could attract and support projects just like this. Ariane has made an excellent decision. We couldn't be happier, and we want to welcome them to Florida. And to do that, we're fortunate enough to have the CEO of Ariane, I think, is joining us. Do you have the link up? Tom Weiss. I wanted to invite him, there he is, to come say a few words about his decision to locate here in Florida. Tom, good afternoon. Thank you for this great news. We look forward to seeing you here, creating these great jobs in Florida and doing all that you can do to produce this great product for Ariane. So I wanted to give you an opportunity, to say a few things about what this means for the company, what it means for the state of Florida, and maybe why you guys decided to choose the state of Florida.
Well, thank you, Governor, for the introduction, and thank you for your acceptance during this extraordinary time. Ariane's vision, as you mentioned, is to revolutionize global mobility through supersonic aircraft that significantly reduce the time of travel while leaving no carbon footprint behind. We had an extensive 2-year study. We considered several potential sites, and Melbourne, Florida emerged as the clear choice for our company to build a new state-of-the-art campus we call Ariane Park. And I just want to mention a few of the things that, the reasons why we picked Florida and the city of Melbourne. The state has an exceptional education system, a significant engineering and manufacturing talent pool, the right business climate with global access, and just a truly unique aerospace and aviation cluster of very innovative technology companies. So this means a lot to Ariane. Ariane Park is our company's global headquarters, and Ariane Park will be an integrated campus for research, design, manufacturing, support of our entire family of supersonic aircraft, starting with the AS-2. So we're very excited and appreciative of the outstanding partnership with the state of Florida, county, and Melbourne community to make this possible. And once again, I just want to thank the governor for his outstanding leadership. So thank you.
Yeah, thanks so much. And can you just, what's the time frame on this?
So we get started actually in the next 180 days. So by the end of the year, we'll start the breaking ground. We've already got a temporary site, so we're already starting to move people into the temporary site, waiting for the facility to get built. And we expect 675 jobs in Florida at Melbourne by 2026.
Well, that's wonderful. Well, I want to thank you for taking the time out to explain this for the folks in Florida. I know the people in Brevard County are going to be very excited with this. The state of Florida is very excited with this. And so thank you for what you're doing, and we look forward to seeing you down the road.
Thank you, Governor.
Thank you. So that's some really good news, and I think gives people some stuff to look forward to in very difficult times. Testing continues to be central to our response here in the state of Florida. We've now tested close to 320,000 individuals. That's one for every 68 people. In Southeast Florida, which of course is the lion's share of our cases, we've tested one for every 46 people. If you look, an interesting thing, if you look at the percentage of cases that positive test results of people 55 and under, it's a clear majority compared to positive case results for people 55 and over. Just positive test results. But if you look at the fatalities, 55 and up, even though they account for a significantly smaller share of the overall positive tests, they account for 93% of the fatalities. People 55 and under, even though counting for many more tests, positive test results, account for just 7% of the fatalities. And so as we're looking at going forward, clearly a key part of our strategy is going to be protecting those folks who are the most at risk to COVID-19. And that tends to be people, certainly the older you are, but then if you have an underlying condition, really at any age, but certainly once you get to be 55 or older, you become more at risk. So the numbers have been very, very clear on that for a long time, really across jurisdictions in the United States and across different countries. I think the numbers in South Korea, for example, would be very similar to what we've seen here in the state of Florida and throughout the United States. One thing that we're looking at is the positivity rate for new cases. That's one of the criteria that Dr. Birx has mentioned, and she pointed out that states are doing a good job of expanding testing, so you may end up getting more positives, but if you're doing more tests and the percent positive is lower, that's a good thing. So like if you look at yesterday, we got more test results, over 21,000 test results in one day. If you look around the country, you can find a number of states that haven't had 21,000 test results for this entire ordeal. So that was a major testing day, a major data dump. And if you look at the new cases compared to that, you're looking at a positivity rate, that's between 6 and 7%. One of the things I'm going to have DOH, I'm working with them on, if you look at the page that they do where they kind of have the graph of the new cases, then beneath that they have the bar graph of the total tests. But then at the very bottom, they have the percent positive, which is very important. But what they do is the number of new cases is never the same as the number of positive results at the bottom of the page. And the reason is once somebody tests positive, they're in isolation, and in order to be able to go back to work, you need to test negative twice. So what's happening is people are testing positive, They're in isolation. As they get towards the end of their 14-day period, they're testing again. They're testing positive again and positive again. Sometimes people are testing positive for 21 days or even more. So you have a lot of those repeat positives, which for us in terms of looking at the trends is really irrelevant. If somebody has been infected 3 weeks ago and they're still continuing to test, that's not telling us how the virus is spreading. So I'm going to ask them to do that because I think that'll be a better context. And as I'm looking at the trend, I'm going to be looking at new cases, divided by tests, taking out the repeat testers, and because I think that that's probably more. So that is, but that's something that we're looking at. And I mean, even with Miami still being in the mix, you're still seeing that positive rate below. People are looking at like Georgia, some of these other places, much higher positive testing rates. Some of the places have 40%, 45%, a lot of places in the 25s. So I think that that's something that we're going to continue to look for, but we certainly like the trend that's happened there. We have our 7 drive-through testing sites thus far with the Florida National Guard. We've had over 67,000 individuals tested just through those 7 drive-through sites. We also support 6 walk-up sites. So those walk-up sites are relatively new. They've already done 4,000 tests, and we've done them in 2 different places in Broward County. We've done multiple locations in Orange County, 2 locations in Hillsborough, and 1 location in Palm Beach County. So this is really bringing testing to the people, particularly in underserved communities, and I think we've done that more than probably just about any other state. And so I want to thank the National Guard for doing that. I want to thank folks like the Broward Urban League who have been instrumental in this. This is really important so that we understand how this virus is affecting communities who may not have the same access to testing otherwise. So that is something that's been very, very positive. When I started the National Guard strike teams for the nursing homes and the long-term care facilities, we had 10 teams of 4 guardsmen each going around doing testing. A lot of this is surveillance testing. A lot of this is trying to identify positives before we see evidence of an outbreak, because I think what we've seen is there have been some examples where a facility did not follow the regulations, either let sick people in, didn't wear the protective equipment, but then there's other instances in which a lot of the procedures were followed, but you had maybe someone asymptomatic and there's an outbreak with the staff and people don't necessarily know that this is there. So we want to try to preempt that, or if we identify an outbreak, limit it and contain it. So they've gone to a bunch of different nursing homes. They've done over 5,000 tests, but we've expanded the number of teams from 10 to 50, because I think this is really, really important. If you look at who is most at risk from this virus, particularly as we've seen a little bit of decline in demand at some of the traditional testing sites, we need to be on offense as much as we can with the long-term care facility. So I think that that's really, really a good thing, and we're going to continue to figure out ways where we can work to help protect the folks who are most vulnerable. Earlier this week, I announced that the Department of Health contracted with 2 new labs to increase our capacity to process 18,000 additional samples per day, and we're going to continue to look for ways to expand even further. I have, as we go forward, the testing is going to continue to be a very important component of this. There is, of course, point-of-care tests. We have a number of those at some of our hospitals, both instant tests and 45-minute tests. Those are not probably going to be produced in sufficient numbers over the next couple months to where every business is going to be able to have one of those. So there's going to need to be places throughout the state where people can go. So we plan on keeping our current sites, plan on supplementing those in areas where we anticipate there being a demand, and then the 18,000 samples processed between 24 and 48 hours. Now look, these are new labs coming online because of the change in the payment reimbursement. We hope that that's the time frame that we're going to be able to continue, but I've told the DOH we need to make sure we have someone that can turn it around in 24 to 48 hours. We just cannot have some of these data dumps towards the end of the week. Like yesterday, we'll probably get a big one today. Some of these tests were taken last week, and that's not as helpful if you have an employee or you need to know if they're positive or not. To wait a week is not exactly the most efficient way to do it. So we want to be able to do that, but there are more labs online now because the reimbursement has gone up. We also have other ideas percolating about how we can involve the serological testing into our testing regime. If you think about it, if you test like nursing home employees and they have the antibodies, well, then that really is less risk then for the residents if they're going to be involved in caring for some of our senior citizens. So how this is done with healthcare workers, people in nursing homes and long-term care facilities, and then trying to get a sense of how many of these antibodies are out there. The University of Miami is working on something. They put out, I think, some initial findings either yesterday or today, but basically, whoever's tested positive, there's antibodies far in excess of that. And that's exactly what Stanford found in Santa Clara, California. It's what LA County found there. New York found something similar. And so we want to continue to look through places in Florida to see that. The more antibodies that are present, the more, obviously, this has been widespread, but I think it means the less lethal the disease has been because the denominator is going to be much, much bigger. And so you're going to have to recalculate the infection fatality rate. But I think these are things that we absolutely need answers to. So we are expecting 200,000 serological tests. We hope to get them today, but these things are coming from China. But there's a company in South Florida that I think just got FDA emergency authorization to do an antibodies test. So we have a contract with them to be able to get a couple 100,000 of those, hopefully within the next couple weeks. And then the federal government is going to be sending antibody tests in the beginning of May to, I think, all the states. So we're due to get a couple 100,000 of those as well. But those will be very valuable resources, and they absolutely need to be integrated into our testing apparatus to be able to do that. I also have another announcement with respect to testing. We got to figure out ways to make it as simple and accessible as possible. So I am today going to direct the Surgeon General under his authority during this state of emergency to allow licensed pharmacists in Florida to order and administer COVID-19 tests. With this direction, it's my hope that pharmacies throughout the state consider how to offer COVID-19 testing. The state of Florida stands ready to help, but that would make this much easier if we had those folks engaged in this where people could be able to get a test there. There's also some of these home tests that are being developed, which is would be really good if that ends up being something that works well, because it would really obviate the need to have all the PPE. If they can just do it at home, put it in and mail it, then you're able to have a sample and you haven't had to burn any of the PPE. So we're also looking at that as well as the saliva test. But I do think allowing licensed pharmacists to be able to do this expands our capacity, makes testing more accessible for people, and I think ultimately is the right thing to do. If you look at our hospital bed availability, we've been pretty consistent between 40 and 45% for the last probably month. For available beds, we have more available beds in both regular beds and ICU beds today available than before the pandemic began. And so protecting the hospital system from getting overrun was the #1 priority to flatten the curves, the #1 reason we engaged in mitigation as a country. And I think here it's been steady as she goes. We don't see a threat to the hospital system, and that's a very, very good thing. For the latest updates on our effort to fight COVID-19, please text FL COVID-19 to 888-777. Again, 888-777. And with that, I'm happy to take a question. Yes, sir.
Two lawsuits were filed in the last 24 hours, one against you and DEO, trying to get a judge to order you to speed up payments. But the second was filed against Deloitte, really alleging that they were negligent in the building of the system. And I wonder what you think about that second suit.
Well, obviously the system was problematic. This was, I don't know, 5, 6 years ago, or whenever this was purchased by the state. It was before I was governor. They spent $77 million. And what's been going on since this thing crashed is people have been in round the clock. These people are working I mean, we have engineers in there. There have been so many changes that have been made. Just this week, DEO has made over 200,000 payments, totaling almost $100 million. There's more changes that need to be made to the system. Those changes are being made to the system, and I think it's going to continue to be to work better. But this thing was a clunker. There's no doubt about it. It was designed with all these different things to basically fail, I think. And there, you know, look, you have states with this volume. It was going to be a problem no matter how good the system was, but I do think the way this thing was designed was very problematic. We're going to have, I want to do one of these briefings where I bring Jonathan Satter in and go over everything that's been done, because I think that if you look at all the things that have been done and how hard people are working on this, because I told them it's our top non-health priority right now, because people do need to get these checks. People were going along swimmingly. All of a sudden, the economy stops. So this has been a shock to the system, and people need to get this to be able to pay the rent. So I'm proud of the hard work, the 24/7. We have 2,200 trained workers from other agencies that have been surged over for this fight. Nothing like that's ever been happened before. And so what they're doing, they're taking the written applications, they are processing those. They've already done 100,000, and we've even done agreements with FSU to have more space so that they're able to work there. So there's a whole host of things that have been done, and it's been a tough thing because the system's been problematic, and it's been a whole, but this has been, I mean, all of last weekend to be able to get to the 200,000 required all kind of engineering on the system. We also had to work with the federal government, because what happens is, even if the state system's working swimmingly, you have to have the Social Security number verified through that pipeline. But that was only going at about 1,000 a day. So that would have taken, so we had to work through that to be able to get those verifications, which are required by the law. But there's been really a lot that has been done, and I can tell you, I understand people are frustrated, and I'm frustrated, but I did not think, with all the problems that this thing had, to be able to get 200,000, I think we're going to be able to get more soon. I really appreciate the hard work, because John Satter's been in there every day. We got engineers working in there every day, because it's important to get the money out. So in terms of I don't know legally about the lawsuit, but I can tell you that system was not a good investment for the state of Florida.
Governor, can you talk a little bit about your testing? You announced that you're going to expand the number of strike teams in nursing homes. The question I have is, will you only be testing those nursing homes that have positives, or will you also be allowing those homes that have asymptomatic?
Oh, no, that's the main reason we're doing it, because we already have screening procedures and PPE that should keep out anybody who is symptomatic from being in the nursing home to begin with. Obviously, if that changes and there's an outbreak, you want to go and test everyone and try to contain it. But we're sending them to places that maybe have had problems in the last couple years with infection control. They haven't had any problems yet, but we want to try to preempt that. So this is an offensive way to try to identify asymptomatic, and really I think some of this is really pre-symptomatic. Someone can shed the virus before they start appearing really sick, and those are the things that are really problematic. So yes, that's the main reason they're doing it. And I also think what we're going to need to do with the antibodies, going to go in with the workers to identify who has antibodies. We also need to test some of the residents for antibodies. Obviously, for senior citizens, particularly heavy conditions, this can be very, very damaging. But there's also people who get it who are older who don't even get hospitalized. So has this virus actually been in some places that we didn't know? We want to see if there's antibodies there with the residents as well. So we're going to do both of those, and I think it's going to be very, very important. But
when it comes to the asymptomatic, or when it comes to the pharmacist testing, will people who get a test need to have a doctor's note or have shown symptoms, or will they be able to go to a pharmacist and say, I think I've been exposed, but I don't know, can I get a test?
I think we have to work through that, but my view would be the latter, that if you're not symptomatic but you think you may have been exposed, maybe someone you know, or maybe you were just in an environment and you figured out that there may have been an outbreak somewhere. We want those people to be able to go in and get tested, because that is really going to help us identify how much this disease has spread in different areas. And then obviously we would want to isolate somebody who was positive yet asymptomatic so they wouldn't be spreading it to other people.
Earlier this week, NASA tweeted asking everybody to stay home during the May 27th launch. There's rumors circling that the roadways into the county are going to be blocked so people can't come. Will that work, or what do you see happening?
Well, that'd probably be a question for Brevard County. They've done a really good job throughout this whole ordeal. If you look at Brevard, if you look at their fatalities per 100,000, their hospitalizations per 100,000, they have 600,000 people there. It's not like it's that nobody lives there. They're very low. Not only, I think they're way below the state average, but they've done it in a way where they've tried to have their citizens be active in accordance with social distancing in a variety of different ways. And I think that they've done a really good job so far. So I would defer to them on that. They've handled this well, and I think they'll handle that issue very well as well.
Governor, your stay-at-home order expires in 6 days. Do you think by then the state will have met the White House criteria for phase 1 of reopening?
Well, I'm not concerned about specific dates as much as I'm concerned about getting it right. So even if we have, well, we certainly have with ILI and the positive downward. And I think if you look at the test results, when you consider some of these had massive amounts of negatives, I think you'd see similar. But I think it's less important about that than it's important about doing this in a thoughtful, methodical, and safe way. And I don't have an artificial date for that. I'm going to work today and all through the weekend about what we need to do, and make sure we're doing it in the way that makes the most sense. But it does not need to be that date. It does not need to be any specific date, because I think that if you do it right, then we'll continue to be able to build off this and be able to get to a place where people can get back on their feet. And part of that is you just want to do what makes sense. We've got some great doctors that are helping us. We've also got obviously a lot of people in the private sector. So you want to make sure it's safe, but you also want to make sure that it's instilling confidence in people. This was a traumatic period, and I think a lot of people are still very, very worried. And I think that we need to show, look, this is going to be an issue. It's not necessarily going away, but we know what we've got to do, and we have a plan to go forward with that. So I look forward to rolling that out over the next many days, and when that would start is absolutely not been determined yet.
2 more questions, please.
Governor, I wonder if you've spoken to the President about what would happen when the state runs out of the trust fund for unemployment is empty. As I read it right now, with 700,000 plus verified cases, that's about 58% of what's in the fund.
Well, we'll see. I think you hear different things about what's going to happen with states, and I know that there's a lot of folks in those discussions. I think we feel pretty good that we'll be able to get through this, but you never know. I mean, these things mount. There's going to be some of these folks, we don't know when the employment market is really going to get back. So these are things that we're just going to have to think about. The good thing is that unemployment, because we had such low unemployment for so long, it did build up a nice chunk of change. It wasn't like that we were bankrupt there. So that's a good thing. And my view has been, let's get this money out as quickly as possible, because this is exactly the reason why you have unemployment system. When something like this happens, you really want to get it out.
Follow up on extending the emergency declaration, is that inevitable?
So we're going to look, and we're going to do everything in a thoughtful way. So there's no firm date where we've got to go to this phase or that phase. Let's make sure we're doing it thoughtfully. Let's make sure that we have input from not just folks in the business community and the medical community, but also folks in local government in different parts of the state. We have a big, diverse state. I think that there's probably some pretty divergent views about the path forward in different regions of the state, and there's nothing wrong with that. And I, from the beginning, have tried to tailor what we're doing statewide to the local circumstances in different parts of the state. So we're going to be looking at that as well. I had a conversation with Mayor Jimenez from Miami-Dade. He's worked really hard, done a really good job down there. Obviously, they've had issues that have been more difficult than some other parts of the state. I mean, they had the Super Bowl in February. You have all these international travels, all these people coming from New York City into southern Florida that really seeded this thing, I think, stronger there than we fortunately saw in other parts of the state. So those are just things that you're going to have to deal with. But I think we got to do it in a way that really is measured. I've been measured throughout this whole thing. I've been focused on the facts. I didn't get carried away. I didn't there's a lot of stuff that was going on a month and a half ago. Just tried to focus on the facts, and let's just focus on the facts now. And I think if we do that, I think that Florida will be in good stead going forward. Thank you.